COVID-19 pandemic's effect on America's waistline has been rough.
Yeah, new data from the CDC show that 16 states are really struggling under the weight of obesity that only got worse with the pandemic. So Pix 11's Kirsten Cole has been diving into this one, and she's here with much more on her little investigative report here.
I mean, this is what we've been hearing about, right?
Yeah.
All of us, most of us experiencing it. The pandemic only intensified what America is already struggling with: anxiety and depression, coupled with a forced isolation, nowhere to go and nothing to do but eat. And those bad habits are the most intense months of our worldwide crisis. Research now showing they have persisted, with hybrid work only adding to the burden of this pandemic obesity crisis.
Good, just tapping down. Awesome.
Dina Dewane is back on track with less back pain and a healthier weight after poor eating and drinking habits took off when the pandemic hit hard.
I stopped exercising, I stopped eating right, I drank too much, and I just got depressed. The pandemic really messed with my head. It took a long time to get back.
Dina's story is America's story. The theme, inactivity is our new norm, and many of us are suffering from pandemic pudge. A study done by the U.S. Department of Agriculture finding obesity rose 3% in the first year of the pandemic. A survey by a psychology association reporting 42% of Americans gained more weight than they intended, an extra 30 pounds more. From trainers to mental health pros, bottom line, the causes were clear.
People were definitely depressed. They were drinking too much. They had their kids at home, not in activities, a lot of stress and no outlet for that stress.
Obesity and mental health are very linked, and right now we're facing an epidemic of both of them.
With the prediction, if it's not reversed, we'll see permanent impacts.
Those comorbidities like being a diabetic or having heart disease and being obese just double and triple the incidence of early death and disease as we age.
Doctors say obesity increases the risk of developing high blood pressure, diabetes, high cholesterol, which can lead to heart disease and stroke. It also increases the risk of breast, cervical, prostate, esophageal, and colon cancers. The prescription, simple, but so hard to achieve for so many.
There's nothing better for your mental health than exercise. We actually know that exercising a certain amount every day can be almost equivalent to taking antidepressants because it actually increases the serotonin.
And endocrinologist and founder of the Grok Health and Weight Loss app, Dr. Florence Comite, saying we're also fighting an especially tough battle.
Our bodies are geared to get diabetes. It's a Darwinian issue. If you're not actively putting on muscle, you're putting on fat and you're losing muscle. And those are very critical issues.
Her treatment often includes optimizing patients' hormones by supplementing with testosterone, a muscle builder, and estrogen and progesterone for women. She also uses increasingly popular hunger management drugs like Ozempic, Wegovy, and metformin to carve off excess weight, saying
it actually invades liver. It invades our visceral organs around our abdomen, and all of it leads to disease.
Weight training, movement, eating more protein, and limiting the so-called comfort carbs are what these experts insist work.
We really have to rethink the way we work today, and it has to include physical activity.
You've been so consistent, and it's really paying off.
It feels good to feel good.
And this weight gain is not limited to just us adults. Another study finding our children are suffering. And overweight and obesity rates in kids ages 5 to 11 years old rose by 10% to 46% of our kids. It is just a stunning number. And our obesity expert had a parting piece of advice for us: sleep. Prioritize it, and you and your children to try and maintain good health. I know that is something that all of us struggle with, especially in this particular shift. But as much as we can, because it really just helps regulate all of those hormonal processes as well.
Yeah.
I think it's tough for people not even on our shift, just parents in general too, that can't sleep because their kids are keeping them awake at night and so on and so forth. It trickles
but
down.
we all just need to find a way.
Yes, I know.
And now that it's getting warmer, you really got to get outside, get the kids moving.
The light regulation is super important for the circadian rhythm as well, which will give you better sleep.